Hello, everyone. My name is LaShawn Benedict, and I'm here with my co host, Gordon Thane. And today we're going to talk about three more very interesting public health courses that you should take to enhance your professional development.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not necessarily represent any of the agencies or organizations we work for or are affiliated with. This is really coming from some of the LinkedIn posts that Gordon and myself have been putting out there. So if you hadn't had a chance yet, follow us on LinkedIn. The links are in the description of this podcast episode. And we post weekly resources to our audiences on LinkedIn. And a lot of them are courses that can be taken for free. And the links to those will be included in the description as well for all the courses we'll be talking about today. But what we found from it is we're getting a lot of engagement when it comes to these types of courses, which leads us to believe people give a crap about professional development. So let's help people find those opportunities for them to develop as professionals, which is part of the things we do here at Public Health Insight. So Gordon, looking at these comments on the posts that I've made and specific to the courses that we'll be talking about today, we've seen a lot of people really thanking us for sharing these resources, talking about the timeliness of some of these resources, talking about the connection to public health and these courses. And a lot of them have said, hey, we're going to try these courses out and learn from it. Thank you for sharing. So what do some of those comments look like, Gordon?
Putting me on the spot there.
No, just generally speaking.
Yeah. I can't remember exactly what the person said, but it was one that I feel connected with us and resonated with us. Is someone who felt like they were at a crossroads in their career and are a little bit stuck.
Mm-hmm.
And I can't remember the course that they ended up taking from the ones that you shared, but there was one that I felt that I think it was communications and marketing. And I know we had some conversations previously about why is that even important in public health.
Mm-hmm.
And from you putting those out there and getting people to see things a little bit differently,
Mm-hmm.
getting people to understand that to fully dive into public health and change public health, you
Mm-hmm.
probably have to go a little bit outside of public health,
Mm-hmm.
bring that external knowledge back into public health, and see public health take 2 steps forward. And this person acknowledged the impact that that specific course had on them, and that they were going to look into other opportunities to further understand how communications and marketing intersects with public health. So that was very refreshing to see that.
Mm-hmm. Yeah, and specific examples from Tennille Brown from Jamaica, your home country, Gordon, right?
Home country.
There it
Shout out to
is.
Jamaica.
Shout out to Jamaica. So Tennille Brown says, thanks for sharing these courses. I'm taking the liberty to repost and share the word for these courses, as I'm sure public health practitioners would find these courses enlightening and benefit to their capacity building goals. And then you have people like David from South Africa saying, these public health courses are game changers. Thanks for sharing them, LaShawn and Public Health Insight. Can't wait to boost my professional growth with these learning opportunities. And I'm going to tag all my friends and colleagues so that the word can be spread. So as you see, people are really excited about these courses, and we're going to do our part to spread the word even more by getting into 3 public health courses that you can take to enhance your public health development. Are you ready, Gordon?
Let's go.
So the first course we'll be talking about is actually a specialization on Coursera where you'll learn about a couple of courses in epidemiology and public health practice. So in these courses, you're going to become familiar with the epidemiological toolset, measure the health of populations, collect and analyze public health surveillance data, and really get into investigating disease outbreaks and epidemics. Now, why, in the love of public health, is it useful to take a course like this?
That's where it starts. epidemiology. That's what we do is based on epidemiology. Everything.
Okay.
Everything that we do in public health is based on epidemiology. The identification of health disparities, inequities, distribution of disease comes from looking at the data, stratifying the data, and then determining what groups are most disadvantaged and what groups are in need of support and more resources. So it all stems from there. I appreciate that a lot of different public health jobs and careers aren't necessarily the ones involved in this specific step. However, it is inevitable that at some point in your career, whether it's you're an epidemiology yourself or you're writing a report about what you did, either way, you have to show that you have an understanding of how epidemiology works, how to interpret data, and how to present data and talk about your evaluation findings, for example. So that's critical.
Yeah, absolutely. And specifically in the specialization, there's actually 5 courses, right? It's going to take you through a bunch of different areas of epidemiology. So, the essential toolkit, data and health indicators, surveillance systems, outbreak and epidemics. However, the free aspect of this is when you click on these individual courses and audit these courses, and you'll have access to all this free content, videos, lectures, readings that can help you with the understanding that Gordon is talking about. So, Gordon, you said it's fundamental when it comes to public health, epidemiology. You're talking about the distribution of diseases, understanding better health disparities. Some other practical examples are really looking at things like investigating the impact of a new public health policy, such as smoking bans or reducing tobacco related illnesses in the community, or tracking trends in non communicable diseases like obesity or diabetes to understand their prevalence and associated risk factors, which is a huge thing in epidemiology. Or, like what happened to us at a public health conference that we went to one time, studying the spread of foodborne illnesses to pinpoint contamination sources and prevent future outbreaks. Gordon, can you tell me a bit about that and a bit of what happened at the conference we went to?
Oh, you're really tickling my brain. That's so long ago. You're talking
Mm.
about the topic conference
Mm-hmm.
2019?
We won't name
Yeah,
it.
there
We
was
won't name it.
2019. Yeah, I think it was in the news. I think it's public knowledge at this point.
Okay.
But I think there was some contamination of a specific meal or specific items
Mm-hmm.
at a public health conference that led to some foodborne illnesses. And obviously, the public health officials had to then go back and trace the origins of what caused the illness. So that involves interviewing people to see what they ate, what time they were there, what meals were served, and then they can reverse engineer essentially what they believe to be the cause of whatever the foodborne illness that people were experiencing. So that was a very ironic, interesting example.
Yeah,
Oh,
absolutely. I'll never forget that because it was just so funny. It happened at a public health conference. And
yeah.
especially since we just had, at the time, finished our courses on epidemiology and biostatistics, the
Mm,
class had a real fun time poking jokes at it. So, good
hmm.
times, good
Yeah,
times.
luckily no one was severely harmed to what we understand. But
Mm-hmm.
I like the range of examples you provided. And the
Mm-hmm.
reason I'm going back to that is because even though I said epidemiology is where everything starts, it doesn't mean that you necessarily go into something and then investigate it. So what I'm really getting at here is sometimes you implement policies. Some policies have positive effects and some policies have a negative effect. That's where epidemiology comes in as well, to understand the impact of a specific policy,
Mm-hmm.
just as epidemiology is important to understanding where policy is needed. So it's like a feedback loop
Mm-hmm.
essentially, where you're applying epidemiology, learning, seeing if anything changed, looking at epidemiology again. So I think it's super fun, super critical. It's not the field that I'm in, but I enjoy that I know and have some baseline understanding of how to interpret data and act on the data. Very important.
Yeah, you enjoy using a lot of the foundational information provided by
Mhm.
epidemiologists to enhance your public health practice. So, shout out to all the epidemiologists out there. All right. So, the next course we're going to talk about is a really interesting topic: Evaluating Public Health Programs at Scale by Johns Hopkins University, which is also on Coursera as an audit function for the course. So, what will you learn? So, in this course, you'll be critiquing an evaluation of an international health program, looking at its strengths, looking at its possible weaknesses, and how they can be addressed. You're also going to make a technically sound evaluation plan for a reproductive, maternal, newborn, and child health and nutrition program being implemented at scale in a low or middle income country. And this is going to include you doing and looking at aspects such as evaluation design, key indicators, measurement methods, analysis, and the important part of communicating these results. So, Gordon, there's a lot more to this course, but right off the bat, when we're talking about evaluating public health programs, why is that important? Why is that
Hmm.
important? Why is that important? Can I just do something that I think will work?
Well, you could do something that you think will work if it's evidence informed, but even if something's evidence informed, you still need to evaluate it. Why? Something that LaShawn implements in Scarborough may not work in London if it's done exactly the same way. So even though LaShawn has good data from what he did in Scarborough 2 years ago, doesn't mean I can blindly implement something because there's different contexts. When you factor in implementation science as well and all the different factors involved there, it's important to evaluate. You
Hmm.
want to know if what you're doing is actually moving the needle and what you're trying to move the needle on. And in
Hmm.
order to do that, you have to not only evaluate something after it's done, you need to have an evaluation plan before you even do the thing,
Hmm.
because you need to set up where you're getting those indicators and measurements from, and that needs to be established prior to the implementation in the first place. A lot of what happens in many cases is you do something and you retrospectively go back and say, how can I show that this works? And then you engage in some kind of biased data collection after the fact, to in a self-fulfilling prophecy to show that something worked, and that is not what I would call good and effective public health practice. So evaluation is critical, and it's important too to be able to share that knowledge. So if you don't evaluate it, how do you write about it, how do you talk about it, and how do you scale it and share that knowledge with other jurisdictions that can say a lot of the factors being described here are similar, and we have reason to believe it may work in this setting, and we can expect and benchmark these results that LaShawn got in his diabetes education program in Scarborough, and that's why it's important.
Hmm. Yeah. And in addition to that, in addition to actually making sure the program or intervention that you're running is relevant to the population you're giving that intervention or program to, when we're thinking about it from an organizational perspective, we want evidence and solid evaluation plans and metrics in order to advocate for more funding in the future, in order to advocate for the impact you're contributing to with these programs or interventions. Oftentimes, when you're talking about funders, whether it's the government, external donors, etc., they want to see these things for justification for them that they're allocating resources and money to the right place, right? So that's why it's also important from that practical perspective. Now, when we're talking about program evaluation, what are some examples of that? So, assessing the effectiveness of national smoking cessation programs and reducing smoking rates. So, that evaluation that you do for that program, it allows you to look at improvements in resource management, improvement on allocation of certain items within public health, and looks at its impact. Or when we're talking about a planning and evaluation for a school based nutrition program to determine its influence on childhood obesity rates, what you're ultimately trying to understand is this program that we're doing, does that align with the different public health priorities or objectives in your region? Right? And that's going to give you a sound foundation for advocating for more funds or justification to continue your program, right? So, as you could see, being able to evaluate programs are important skill in public health, and it really provides you with the foundation and justification for what you're doing and seeing if it's working, if the population that you're working with likes the program, they don't like it, it's not working, and provides that justification for future financial funds that will help support your program in a very sustainable way. So, shout out to all the evaluators out there. Specifically, shout out to Shadi, who works with me on my team and is a evaluator. I call her the data master. And so, for the last course that we have on our list, and just a reminder to subscribe to our podcast if you're enjoying what we're talking about, and follow us on LinkedIn. Links are in the description.
If you have courses that you've taken
Mm,
that you really liked that maybe we haven't covered yet, let us know about it.
yeah, we're down to
Tell
hear
us.
from you. So, that
Mm.
last course we're talking about is Economic Evaluation Basics, and it's featured on the Global Health Learning Center. So, economic evaluation. We just talked about program evaluation. Now we're talking about economic evaluations. What will you learn in this course? You'll understand the key concepts related to economic evaluations. You'll describe the role of economic evaluations within the field of public health. You'll be able to identify common methods of economic evaluation and determine which method is the best for any given situation. You'll understand how to process and conduct an economic evaluation, and you'll recognize how the application of economic evaluation methods can help influence policy and program related decisions.
It's pretty solid.
Solid and similar to what
Mm.
we were talking about with program evaluation. What's the focus here, Gordon?
Well, before we say that, I
Mm-hmm.
really like that the course is less than 2 hours.
Mm-hmm.
So it gets your feet wet and understanding again that this is not something that maybe you'd want to dedicate your whole professional career to.
Mm-hmm.
A fundamental understanding of the basics of economic evaluation can put you on a right path because we get money to
Get
do stuff,
money. Let's go.
to do right, get money to do stuff. And then oftentimes it's not only, the first course, so Sean, we talked about evaluating a program. Okay. That scenario is very important, especially when you get money to do something specific. You need to do a diabetes education program for this population during this period of time and report back on how things went. In that case, you're not necessarily doing an economic evaluation because you're not necessarily choosing between two things. In public health, you might have 100,000 and you're choosing between like diabetes prevention and cancer prevention or something. And part of the decision making involves where are we getting the most bang for our buck. So it's not necessarily that one is more important or less important than the other. It's just that by putting resources into X, we see better gains in that thing than putting the same amount of that resources into the other thing,
Mm-hmm.
right? So that's where economic evaluation comes in. And I think a fundamental understanding of that, shout out to Dr. Ava John Baptiste
Okay.
for teaching us the basics of economic evaluation. So that's very important. And I think it's a definitely something that you can use to level up your standing as a public health practitioner for sure.
Yeah, important thing to note here, money is important. In
Mm.
the public health setting, money is limited. What program are you going to choose?
Mm.
Depends on a lot of things, especially money.
Mm-hmm.
Given that money that you have, what's the farthest you can go with that money in terms
Right.
of health impact, right?
And LaShawn, these are the conversations too that funders often will have internally. So it's not necessarily that you, as
Absolutely.
the one delivering the program, would have a vested interest in this. It's the person holding the purse strings or
Yeah.
the agency or the institution saying, of this funding that I have put aside, what things do I want to fund? And you can absolutely bet on it that economic evaluation or value for money is one of, if not the most important thing that is being used to make decisions.
So, one of those examples would be we're calculating the return on investment for a community wide exercise program in preventing chronic diseases. So, really, what we're using economic evaluations to do is it helps public health programs like the one I'm talking about and help the people running those programs advocate for the funding and support for other preventative programs, right? We're also talking about how we can use economic evaluations to ensure that as we're doing public health investments, how do we achieve the greatest health impact with limited resources? And that would be, like Gordon said, if you're picking between different programs, you have limited money, what will take you the furthest? Okay.
I would also say another good example that just came to my mind. We're talking about cost of living crisis, the housing crisis. And though building more houses is not necessarily a health policy, it's more of a healthy public policy.
Mm-hmm.
You are able to then look at how much money could you save if you built affordable housing over the next 10, 20 years versus building more hospitals and homeless shelters and addressing the opioid crisis downstream, adding all those things together and weighing it to see what thing will afford you the most health savings or savings to society down the road is very important. The challenge comes with this, LaShawn, is when you're going to realize the savings. So even though prevention
Mm-hmm.
is the most cost savings out of everything,
Mm-hmm.
the return on investment tends to not come till way, way, way down the line,
Mm-hmm.
which exceeds what a political cycle is. So a politician coming in who wants a quick win isn't necessarily going to want to invest in prevention because those gains won't be realized till they're out of office. So that's where we're in this conundrum in public health where we're constantly funding things that give us a quicker return on investment that are not as effective as something more long term that can have more benefits. That's the
Mm-hmm.
problem. But
Yeah,
that's a
exactly.
story for a different day.
Yeah. And part of what you're saying in this overall conversation around economic evaluations is, how do you actually quantify and make that connection between money and health outcomes? Well, one of the things Gordon and I should be familiar with now, and you would learn if you decide to pursue this course and other courses related to this, is the idea of disability adjusted life years, DALYs, and quality adjusted life years, QALY, which are measures of population health used to really quantify that burden of disease or injury. So a DALY is a measure of lost healthy life years, while QALYs is a measure of how many years of life are lived in good health. So these are metrics that can ultimately help you make those justifications when it comes to which program is better in terms of money, in terms of health burden, and different decision-making metrics. These are some things that'll help you.
They use this a lot on drugs too. When they're bringing drugs to market and deciding whether to cover drugs, governments, they look at those exact things that you mentioned. Remember the homie ICER?
The ICER tables? Oh
ICER
my.
tables? Right. I don't remember what ICER means, but I remember ICER tables.
Okay.
Okay.
That's hectic. That's a throwback
Right.
for
So
sure.
yeah, if you know what ICER means, tell us. I can't remember what it means.
Take the course and maybe you'll learn more about it. All right. So with that, we talked about a lot today. We talked about epidemiology, the toolkits. We talked about program evaluation, why those are important, especially the justification for the outcomes of a program and if it's working. And finally, we talked about economic evaluation and how you are going to do your PhD in economic evaluations. Okay? So, without further ado, we want you to subscribe to our podcast and follow us on LinkedIn to learn more and keep up to date on professional resources and other podcast episodes such as this one. And why wouldn't you, especially with Gordon over here, dropping facts? With that, this is the Public Health Insight Podcast, your number one spot getting professional development resources, learning about public health topics and global health topics as it relates to the social determinants of health and the sustainable development goals. I'm LaShawn. I'm signing out. Bye-bye.
Ciao. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.